Hi, welcome interns. My name is Dr. Dana Steitman. I'm a licensed clinical psychologist and a faculty member at the Johnson Depression Center on the Anschutz Medical Campus. And I'm here today to talk to you a little bit about our outpatient psychotherapy minor rotation as part of the Department of Family Medicine Psychology Internship. So the Johnson Depression Center, or JDC as we call it for short, is, as I said, located on the Anschutz Medical Campus. We're an outpatient specialty mental health clinic, and we focus primarily on mood and anxiety disorders. We include a team of providers that includes, of course, psychologists, also social workers, psychiatric nurse practitioners, and psychiatrists. And so as part of that team, clients coming to our center might be looking for psychotherapy and or psychiatric medication services. And we actually do work with a good number of faculty and staff from the Anschutz Medical Campus. So we do see a good number of kind of healthcare folks that interface with healthcare in one capacity or another. Anxiety and depression, of course, are common diagnoses that we might work with, as that's our specialty. We also see a fair amount of trauma, PTSD, and associated kind of comorbidities, as well as grief and loss and adjustment issues from time to time. In terms of what the rotation looks like at our site, so interns will have the opportunity to carry their own kind of caseload of about 3 to 6 clients, individual psychotherapy clients. And that could include from the start, from doing kind of an initial intake and evaluation, coming up with a treatment plan, treatment formulation, and then working with them over time in psychotherapy. And many of our appointments currently are conducted by telehealth, and that's been in part, of course, due to COVID-19, but we are also finding now that that's what our clients like, so we have continued that. So potentially some of the therapy or much of it may be by telehealth. We do have an option for in-person services, and that would be, I think, a conversation if someone was interested in the rotation to kind of see what was available and what they were interested in doing, what kind of mix of telehealth versus in-person. The caseload, of course, is overseen by an attending psychologist, which is usually me. And I aim to meet with folks for at least 1 hour each week for individual supervision. That could occur through teleconference or through face-to-face. And the therapy appointments in our setting are typically the kind of classic 50 to 60 minute outpatient appointments and are roughly weekly, probably for clients, although of course that will be adjusted based on what the client needs and how they're doing and so on. Psychotherapy emphasis at the JDC is on evidence-based therapy. So that includes a lot of the CBT approaches, cognitive techniques, exposure-based treatments, MI, behavioral activation, as well as ACT, acceptance of commitment therapy, and also DBT if there's of interest there on an intern's end, and or it seems relevant or helpful for the clients they're working with. And, you know, in line with a lot of the research evidence around the importance of non-specific factors for psychotherapy outcomes, there's also an emphasis on developing a strong therapeutic relationship and sort of integrating various aspects of evidence-based treatments into a specific individual's kind of overall formulation. We use a team-based approach here at the JDC, so a lot of our clients might also see another provider at the clinic for medication management. And so we encourage collaboration, consultation with those other team members. We talk about our philosophy of having nobody worry alone, as in, you know, we want an intern, we want each other to feel like if we encounter a challenging situation or something where we need additional feedback or we feel stuck, that we can seek input from a team to try to really navigate and best help the folks that we work with and navigate challenging situations. Because we do have prescribers at the clinic, sitting in on medication evaluations or medication management appointments can be an option if interns are interested, although it's not required. And in terms of maybe other kind of, you know, focus during supervision, I'm always open to discussing issues around mentorship or professional development, you know, career goals and things that are coming up there as well, if or as they're coming up while the intern is at our site. In terms of workload and expectations, so typically the rotation is about 8 hours a week, and that has often looked like carving out 1 day per week for the JDC rotation. Some folks have also done 2 half days, and it seems like either of those configurations has worked pretty well. Our clinic hours are 8 a.m. to 5 p.m., so typically an intern's hours would fall within those hours. At the JDC, we keep our clinical documentation on the EPIC electronic medical record system. And in terms of kind of expectation on notes, we ask that for like an initial intake or evaluation note, that documentation is up within 1 week of the visit. And for follow-up visits, that an intern would have that documentation completed within 48 hours. So who is this rotation a good fit for? You know, I think that this rotation, per the description, is really a good fit for someone looking to advance their skills in individual psychotherapy with adults, and especially kind of case formulation and integration of various treatments, but also really looking to build, for someone who's looking to build autonomy and confidence in doing that and kind of build their independence. Of course, you know, compared to some of the other settings, I think our setting is unique in allowing interns to work with someone over time. So if you enjoy that kind of work, if you're interested in doing kind of medium or longer term therapy, then this can be a good fit. Potentially, folks might start with someone early in the rotation and work with them in therapy for much of the 6 months they're at our site. Someone interested in advancing knowledge and experience in evidence-based therapies, which is, you know, as I mentioned, is an emphasis for us. And also who enjoys being part of a team. I think we have a really, I'm of course biased, but I think we have a really lovely collegial group of folks working here. And that's a nice part of the rotation. And lastly, I'll add, you know, potentially someone who's maybe interested in getting a sense of what it might feel like to be in a group private practice setting. The JDC is of course not a private practice. But as someone who has worked previously in private practice, in a group private practice, I think that there are some parallels, and it kind of does give a bit of a flavor of what that might feel like. And just in terms of wrapping up, just want to share that I really value the sort of importance of the intern year. I know what a big year that can be for people, and I really value training and want to work with interns to try to make this, you know, the best experience it can be for you. So I try to be flexible, and I am committed to working with folks to try to craft the experience that they are most looking to get out of the site, you know, within the constraints of what we can do at our site. Please feel free to contact me with any questions about the rotation, and I believe my contact is on the website. But I'll also share my email here. It's Dana, D-A-N-A, .Steitmann, S-T-E-I-D-T-M-A-N-N, at cuanschutz.edu. And lastly, if you're interested in finding out more about the Johnson Depression Center, you can check out the website, and that URL is coloradodepressioncenter.org. All right, well, thanks for listening, and thanks for your interest in the outpatient psychotherapy rotation at JDC. Take care.